Hello and welcome. Today, we're going to explore a complex and often misunderstood neurological disorder, frontotemporal dementia, or FTD. This condition, unlike Alzheimer's disease, which primarily affects memory, impacts personality, behavior, and language. Join us as we delve into the intricacies of FTD, shedding light on its causes, symptoms, diagnosis, and potential treatments. The precise causes of FTD are still being investigated, but it's understood to be a neurodegenerative disease, meaning it's caused by the progressive loss of nerve cells in the brain. While genetics play a significant role in a portion of cases, often around 10–20%, with mutations in genes like MTGRN and CNOF72 being most commonly implicated, the majority of cases appear to occur sporadically, without a clear family history. Environmental factors and other genetic influences are likely involved, but more research is needed to fully understand these triggers. At its core, FTD involves the degeneration of neurons, particularly in the frontal and temporal lobes of the brain. This degeneration leads to brain atrophy, or shrinkage, in these regions. Microscopically, there are abnormal protein accumulations within the neurons, most commonly involving Tau protein or TDP43 protein. These abnormal protein deposits disrupt normal neuronal function, leading to the characteristic symptoms of FTD. The specific type of protein involved and the exact pattern of neuronal loss vary depending on the specific subtype of FTD. FTD is less common than Alzheimer's disease, accounting for an estimated 10–20% of all dementia cases. It tends to affect people at a younger age than Alzheimer's, typically between the ages of 40 and 65, though it can occur both earlier and later in life. Because of its relatively early onset and often unusual symptoms, is frequently misdiagnosed or overlooked, leading delays in diagnosis and appropriate care. It affects men and women roughly equally. The signs and symptoms of FTD are highly variable and depend on which areas of the brain are most affected. However, there are some hallmark features. Changes in personality and behavior are common, including impulsivity, apathy, social disinhibition, repetitive behaviors, and a decline in personal hygiene. Language difficulties can also emerge, such as trouble finding words, understanding speech, or producing fluent speech. Some individuals with FTD may also develop motor symptoms similar to Parkinson's disease or amyotrophic lateral sclerosis, an ALS. These symptoms can significantly impact a person's ability to function in daily life and maintain relationships. Diagnosing FTD can be challenging due to the variability in symptoms and the overlap with other neurological and psychiatric conditions. A comprehensive evaluation typically involves a thorough medical history, including family history, a neurological examination, neuropsychological testing to assess cognitive function, and brain imaging studies such as MRI or PET scans. These scans can help identify atrophy in the frontal and temporal lobes, and may also detect abnormal protein deposits. Genetic testing may be considered if there's a strong family history of FTD or related disorders. FTD is not a single disease, but rather a group of disorders characterized by frontal and temporal lobe degeneration. It's often classified based on the predominant symptoms. Behavioral variant FTD, or BFTD, is characterized primarily by changes in personality and behavior. Semantic dementia primarily affects the ability to understand the meaning of words and objects. Progressive non-fluent aphasia mainly impacts the ability to produce fluent speech. There may also be forms of FTD associated with motor neuron diseases, FTD-ALS. Understanding the specific subtype of FTD is important for predicting the course of the disease and tailoring treatment strategies. Currently, there is no cure for FTD, and there are no medications specifically approved to treat the underlying disease process. Treatment focuses on managing symptoms and improving quality of life. This often involves a multidisciplinary approach, including medication to address behavioral problems like aggression or depression, speech therapy to improve communication skills, occupational therapy to help maintain independence, and physical therapy to address motor symptoms. Supportive care, such as counseling and support groups, is essential for both individuals with FTD and their caregivers. Because the causes of FTD are not fully understood, there are no proven strategies for prevention. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and cognitive stimulation, may help promote overall brain health. Genetic counseling may be beneficial for individuals with a strong family history of FTD or related disorders to assess their risk and explore potential options. The prognosis for individuals with FTD is variable, but generally it's a progressive and ultimately fatal disease. The rate of progression and the specific symptoms that develop can vary considerably from person to person. Life expectancy after diagnosis is typically 6 to 8 years, but this can range from 2 to 15 years or more. Recent research is focused on developing new therapies that target the underlying disease mechanisms, such as strategies to reduce the accumulation of abnormal proteins. Clinical trials are underway to evaluate the safety and efficacy of these potential treatments, offering hope for improved outcomes in the future. Support and understanding are critical throughout the course of this challenging illness.